If you're super healthy and you don't need medications, amen. Thank God you don't need it. Some of us do. I'm Lucretia, and this is my channel. Welcome. If you are brand new, thank you so much for checking me out. If you are a returning friend, I appreciate you so much. All right, let's get right to it. Today, there's a problem. My pharmacy has been attacked, and it's been attacked by cyber criminals.
Cyber attack on Change Healthcare, the nation's largest commercial prescription processor.
Unfortunately, we live in a world where we need to look over our shoulders in many ways. And one of those is cyber issues. And here is what's happening. This is from Reuters, which is, if you don't know, is a very reputable organization. So I happened to stumble upon this because I tried to fill a prescription today and found out that my pharmacy was attacked. Let's see what this is all about. So the three organizations it's showing attacked are Change Healthcare Holdings Incorporated, Blue Cross Blue Shield of Montana, and CVS Corporation. And I have a prescription at a CVS pharmacy. What it says is pharmacies across the United States are experiencing disruptions following a hack at United Health's technology unit. Change Healthcare, several pharmacy chains said in a statement and on social media. The problem began on Wednesday after a suspected nation-state associated cyber security threat actor. That is a mouthful right there. Let's say that again. A suspected nation-state associated cybersecurity threat actor gained access to Change Healthcare's information technology system, United Health said in a filing on Thursday. Yeah, they did. Once we became aware of the outside threat, in the interest of protecting our partners and patients, we took immediate action to disconnect our systems to prevent further impact, Change Healthcare said on its status page. The company did not immediately respond to a request for further comment. In its filing, United Health said it cannot estimate the duration or the extent of the disruption at this time. It said that it had retained security experts and was working with law enforcement. Well, I had hoped they would have security experts prior to this attack that could keep this from happening. Just a thought. A variety of pharmacy chains said that the outage at Change Healthcare, a Tennessee-based provider of healthcare billing and data systems and key node in the U.S. healthcare system, was having knock-on effects on other businesses. CVS, which has more than 9,000 pharmacies, said in a statement, the hack meant that in certain cases, it was unable to process insurance claims, which is true. We're committed to ensuring access to care as we navigate through this interruption, the CVS statement said. A spokesman for the chain didn't immediately respond when asked for further details. So I can give you some further details, and I will put this down in the below in the information. So I came about finding this because I was trying to fill a prescription for myself. And I was informed that my insurance would not be able to process it. Well, first of all, this isn't something I use insurance for. I pay cash. It is extremely inexpensive medication. But I asked more about it. I was curious. And apparently a couple of days ago, cyber attack happened. And what it's affecting is the ability for the pharmacy to use billing to an insurance company. So insurance companies are not processing, according to my pharmacy, are not processing these. They have shut down that ability. So I wonder how many people who are CVS clients, patients, have life-saving needed medication there that goes through a prescription process with a billing insurance that are not going to be able to get those right now. It's very, that's what popped into my head. I thought about the people who their lives depend on medication. So they asked if so I said, I don't do that. I don't have I don't go through a billing, but I do use a discount card, a well-known discount card. And they said, well, that discount card was also affected. Can't be used. Okay. But would I be willing to use their in-house discount card? Well, sure, as long as it matches, at least what the old one did. It brought me to thinking about my medications, because I take a few medications, and a couple of them are important medications for me. I would consider life-saving medications, life-sustaining medications, I should say, instead of life-saving, life-sustaining medications. At the very least, giving me quality of life, So for my insurance that I use, which I use Medicaid. I'm not yet 65, and I am at an income level that I don't qualify for any other insurance. I qualify for Medicaid, which, by the way, has done very well for me. I would not say anything negative about it. So I know that I can get 3 months worth of medication if I subscribe to their online mail order medication delivery. And I think I'm going to change over to that, because it would be nice to know I have a 3 month at least stash of medications that I really need in case there was a major attack. Pharmacies, it just makes sense to me. So I think I'm going to look into that and make that change possibly. So unless I can get the 90-day supply instead of the 30-day supply that I currently get month to month. So I don't know about you, but that's a pretty important aspect of my life. If you're super healthy and you don't need medications, amen. Thank God you don't need it. Some of us do. So I hope you're taking care of yourself. I hope you're having a beautiful day. Stay healthy. Stay safe. Watch out for cyber attacks. And most important, find your passion. Find your passion. Figure it out. Live it to the best of your ability, because there is no guarantee about tomorrow. All right? Have a beautiful evening.